بسم الله الرحمن الرحيم. Assalamu alaikum wa rahmatullahi wa barakatuh. Dear students, I'm Dr. Abir Ali, and I would like to present to you a practical lesson regarding the pathology of the hepatobiliary system and pancreas. The first topic is liver cirrhosis. Now, what is cirrhosis? Cirrhosis simply refers to a diffuse process in which the entire liver architecture is transformed into nodules of regenerating hepatocytes separated by anastomosing bands of fibrous tissue. It is the end stage of many chronic liver diseases, and some of the major causes of liver cirrhosis include chronic viral hepatitis B and C, alcoholic and non-alcoholic fatty liver diseases, some immune-mediated disorders like autoimmune hepatitis, and some inherited metabolic disorders. Now, on gross or macroscopical examination of a cirrhotic liver, the surface is characterized by being diffusely nodular, and according to the size of the nodules, cirrhosis can be classified into three types: micronodular cirrhosis, macronodular cirrhosis, and mixed nodular cirrhosis. Now, in this slide, the cut surface of the liver is diffusely nodular, and the size of the nodules is less than 3 millimeters in diameter. Therefore, it is called micronodular cirrhosis. These nodules are composed of regenerating hepatocytes separated by bands of fibrous tissue. In this slide, the external surface of the liver is diffusely nodular. However, the size of the nodules is equal or more than 3 millimeters in diameter, may even reach up to 2 centimeters or more. Therefore, it is called macronodular cirrhosis. The nodules are composed of regenerating hepatocytes separated by fibrous septa. The last type, which is known as mixed nodular cirrhosis, is characterized by the presence of both small and large nodules. This slide shows the differences between a cirrhotic liver and a normal liver on macroscopic examination. The normal liver, which is on the left, is composed of a large number of hexagonal lobules consisting of plates of hepatocytes surrounding the central vein with the portal tracts located at the periphery. The cirrhotic liver, which is present on the right, shows complete loss of normal liver architecture with the presence of fibrous bands dissecting the liver parenchyma into round nodules of regenerating hepatocytes. The nodules are marked by the blue arrow, while the bands of fibrous tissue are marked by the black arrow. This is also a case of liver cirrhosis, and we can all notice that the architecture of the liver is completely lost and replaced by a number of nodules of regenerating hepatocytes. The nodules are marked by the black arrows and are separated by broad bands of fibrous tissue that connect between the portal tracts. The bands of fibrous tissue are marked by the white arrows. Chronic inflammatory cells have infiltrated in the fibrous septa. This histological section of the liver has been stained by a special stain called reticulin stain in order to visualize the fibrous septa. And it is very obvious that the architecture of the liver is completely lost, with the presence of several pale, sharply demarcated nodules of regenerating hepatocytes, which are marked by the black arrows and are separated by broad bands of fibrous tissue marked by the red arrows. The second topic regarding the pathology of the liver is tumors of the liver, which could be benign, borderline, or malignant tumors. The most common hepatic neoplasms are secondary carcinomas. This cut surface of the liver shows several yellowish nodules of different sizes, marked by the black arrows. Some of the larger nodules show a central area of necrosis, which is known as embolization, marked by the red arrow. The nodules represent secondary carcinoma to the liver. The most common primary malignant tumor of the liver is hepatocellular carcinoma. Most hepatocellular carcinomas arise in the setting of chronic liver diseases with cirrhosis, while up to 20% arise in a non-cirrhotic liver. And the most common underlying diseases that cause hepatocellular carcinoma are chronic viral hepatitis B and C, some metabolic disorders like hereditary hemochromatosis, alcoholic and non-alcoholic fatty liver diseases, and exposure to certain toxins like aflatoxin. Grossly speaking, hepatocellular carcinoma can present either as a single mass, unifocal, or multiple masses, multifocal, or in a diffusely infiltrative type. This liver shows a single, well-demarcated gray-whitish mass, which is marked by the black arrow, with multiple small areas of hemorrhage marked by the white arrow. This is a case of hepatocellular carcinoma. Hepatocellular carcinomas range from well-differentiated tumors to highly anaplastic lesions. And on microscopical examination, the pattern of growth of hepatocellular carcinomas may be trabecular, pseudoglandular, or in the form of solid sheets. In this slide, the malignant hepatocytes are arranged in the form of trabeculae, showing features of nuclear atypia like pleomorphism and the presence of large hyperchromatic nuclei, with bile production by the tumor cells, which is marked by the black arrow. Now, let's talk about some of the diseases of the gallbladder. And about 95% of the biliary tract diseases are due to gallstones. There are two main types of gallstones. The first is cholesterol gallstones, mainly composed of crystalline cholesterol monohydrate. And the second is pigment gallstones, mainly composed of bilirubin calcium salts. Let's start with the cholesterol gallstones. There are two types of cholesterol gallstones: pure cholesterol stones and mixed cholesterol stones. These are three pure cholesterol stones. The two spherical or rounded stones on the left, which are marked by the black arrows, have a nodular outer surface and are yellowish in color, while the oval-shaped stone on the right, marked by the red arrows, has been bisected, showing yellowish material inside, representing the radiating cholesterol crystals. The second type of gallstones is the pigmented gallstones, which can arise anywhere in the biliary tree. And pigmented stones are of two types, the black and brown pigmented gallstones. In this slide, the gallbladder is distended and it contains several faceted black pigmented gallstones. Black pigmented gallstones generally are associated with chronic hemolysis occurring in sterile gallbladder bile. The second important disorder of the gallbladder is inflammation of the gallbladder, which is called cholecystitis. Cholecystitis could be acute, chronic, or acute superimposed on chronic cholecystitis. Chronic cholecystitis may occur following repeated attacks of acute cholecystitis or in the absence of any previous attacks. It is almost always associated with gallstones. This is a case of chronic cholecystitis and cholelithiasis. The gross examination shows the inferior surface of the liver with the gallbladder and the common bile duct. The gallbladder is contracted with a markedly thickened fibrous wall, and the lumen is filled with several faceted gallstones marked by the white arrow. The common bile duct is dilated, which is marked by the blue arrow. The microscopic examination of this section taken from the gallbladder shows features of chronic cholecystitis. The mucosa is chronically inflamed with dense chronic inflammatory cells infiltration throughout the wall, which is marked by the red arrow. The elongated mucosal glands are lined by a single layer of columnar cells, marked by the black arrow, and the muscle coat is hypertrophied and thick, which is marked by the blue arrow. There is a slight increase in the amount of fibrous tissue. This is also a case of chronic cholecystitis, and on macroscopic examination, the mucosa shows irregular folds with chronic inflammatory cell infiltration throughout the wall, in addition to the presence of muscle coat hypertrophy and fibrosis, which are marked by the black arrows. Also, we can notice the presence of invaginations or herniations of the mucosal epithelium through the wall, marked by the blue arrow. This is known as the Rokitansky-Bischoff sinus. The last topic is one of the important diseases of the pancreas, which is acute pancreatitis. Acute pancreatitis is a reversible inflammatory disorder that varies in severity from focal edema and fat necrosis to widespread hemorrhagic necrosis. The most common cause of acute pancreatitis is biliary tract diseases, mainly due to obstruction by gallstones and excessive alcohol intake. In acute pancreatitis, the pancreatic enzyme lipase leaks out of the acinar cells and ducts and can attack the fat cells in the pancreas and in the extra-pancreatic tissue, like, for example, the omentum, causing focal areas of fat destruction. This is an example of acute hemorrhagic pancreatitis, and the slide shows the omentum, which is covered by numerous small yellowish-white foci of fat necrosis marked by the black arrows. At the end, I thank you all for listening and I wish you good luck.